Dr. Garate, we haven't talked about the root canals yet. Tell me, why do people need root canals when, and especially tell me, a lot of people complain they have the root canal and then the doctor says, and now you need a crown, you need to cap it, so to say.
Mm-hmm.
And a lot of patients feel like vested interest from the part of the dentist. Kind of, why do I need that? You know, it's fine now.
I'm going to drink this water. I'm going to give you a perfect example. This cup right here, sometimes when we get a root canal, the dentist or the specialist has to make a hole big enough to see the canals that are very small down at the bottom.
I see.
The walls on the outside become very thin. So when we eat, the tooth is very prone to bending and to breakage. I always like to explain it in a very simple way, because a lot of people feel that, okay, I get a root canal, but what do you mean I need a crown? I mean, why would I need a crown? And the truth of the matter is most people need a root canal because bacteria have invaded the tooth, have infected their nerve, have infected the blood vessels, and that infection needs to get removed. The nerve has to be amputated or removed in order to relieve that pain or that discomfort. I would say a lot of cases, a lot of people have fillings that have been there for a very, very long time. The tooth has been broken. And I always explain to people, I really hate to remove this very old filling because your cavity is so deep. And I show them where the nerve is, where the filling ends, and there's very little amount of space because the bacteria have been eating the tooth underneath there, and they end up needing a root canal. So I always like to make sure that people understand that if we're going to touch a tooth, there is a high likelihood that the root of the tooth is going to, to become sensitive because the bacteria have already infected the tooth. Now, a root canal is really one of the last resorts in order to save that tooth. If that infection is not addressed early enough, you are in the process of losing a tooth. And sometimes that infection or those bacteria that are very aggressive do not stay in that area. They will move to other areas, so they will infect otherwise healthy teeth. So anytime I have...
And they will move into the bloodstream and affect the whole body, just like gum disease.
Yes, and actually those are quicker results as far as the bad stuff that happens because there's a larger concentration of bacteria that is going directly into our bloodstream. Most of the time, we think of teeth as individual organs and entities that we can amputate. What most people don't realize is that they're connected to the rest of our body. So if we want to be healthy, we need to have those infections that are inside our mouth not be there. And most people don't think of bacteria. Like, for example, I always mention people when you have the flu, and I always talk to people, I'm talking to people, and I say, okay, your tooth is infected, and the tooth is right next to other teeth. You do realize that? And they're like, yes, of course. The tooth is not going to move away. Okay, I have the flu. If I invade your personal space, what would you do? And they're like, I'd move away. I'm like, okay, perfect. That's what happens with teeth. They can't move away, so you have bacteria infecting otherwise healthy teeth. And a lot of people when they see it that way, it's like I tell people, listen, your teeth have the flu. They have a very severe flu. Do you want your other teeth to get infected? They're like, oh, no, of course not. Okay, great. We need to treat these large infections, and root canals are, I would say, probably the #1 cause why people have all these diseases and these immune problems that they never find out why.
Wow. Well, I've never heard anybody explaining it like, the flu thing of like, you stay away from people with the flu. It's kind of forgiven. You learn that as a child, and but the teeth, they don't have that option. They can't do it. We see this porcelain, we see this enamel, we see this tooth being so strong, right? And we think nothing goes through. But it's not true, because inside it's all soft, and it always goes into the flesh and into the body where it's all open. Just that outside which we see, which is hard and tough, but not in the inside, right?
Yeah. Yes, exactly. And that's the part that a lot of people take for granted. I mean, they say, okay, it doesn't hurt. And then they see it on an x-ray, they see it on a CT scan. And until they see it in pictures, until they see it physically there, they're like, oh, wow. And then they start seeing, you know, with the technology of, for example, 3D combing, they see these infections, these round things around the end of the root. They're like, that shouldn't be there. That's not on my other tooth. That's not on my other tooth. It's like, yes, these bacteria, they're not going to stay there. You do understand that. Yeah. And they're like, oh, yeah. And anytime I bring it down to the fact that it's bacteria, most people don't realize that every single problem that they have in their mouth is either by use or caused by bacteria, one of the two. And most people don't, for some reason, they separate the mouth as far as the effect of bacteria on their mouth. For example, most people know that if I get a cut on my hand, I need to keep it clean in order for the wound to heal. If I get it dirty and I keep it dirty, I'm going to have an infection. Most people realize that. For some reason, there's a disconnect between what happens in our mouth. I don't know why, but hopefully it's something that will change, where the newer generations keep getting all this information, and it becomes common knowledge, because the knowledge is there, but it's just not common knowledge.
So basically, it's up to you. It's up to you, dentist. And I think with dentists like you, that will just happen. I guess every so often, you just have to bend our arms a little bit more. You know,
Yes.
Being Mr. Nice Guy sometimes probably doesn't do it with us.
Well, I like to draw. I like to use video. I like to use the tablet with the technology. I like to draw it. And once I put it in an understandable way, most people, I would say, if I say, for example, okay, Mr. Flash, you have a periapical abscess. This tooth will need to be root canaled and it will need a crown. I just said big words. You don't understand them. You're like, okay, how much is that?
Doesn't paint the picture in my mind.
Yes, exactly. So it, you know, it just goes above, and it gives this air of superiority where, you know, I just said three really big words, and I'm a big doctor. But the reality is that I like to draw things. It's like, hey, listen, Mr. Flash, this is what's going on. And I start drawing it, and I start showing it, and they start seeing it, and they start understanding it. It's like, oh my God, how come nobody's told me this? That this can happen. And as soon as they start seeing a drawing and a video, they start seeing on a tablet, they start getting the mass of what's going on inside their body that they can't see. People take responsibility and take action, and they start resolving these issues.
Wonderful. Well, very, very, very informative. I'm sure lots of people will kind of like go and say, let's go and fix this. Thank you very much, Dr. Garate.
You're welcome. Thank you.